Hey guys, welcome back. We're going to be talking about continuing to talk about the bones today. Previously, I had done and introduced and talked about the skull. And so we talked about the skull, and so now we're ready to continue moving down the head, covering the rest of the axial skeleton. So that is the head, the vertebral column, and this all the way down through the trunk. So that's going to be the axial skeleton. And we are ready to start with the mandible. Now, I'm going to be on page 4 of this handout, and I'm going to try to get this in a way that hopefully you can see these bones and bone markings. For the mandible, I'm referring to page 257 in your textbook, and then as well as the study guide handout. So, the mandible, where it connects with the skull, so this right here, that is the only movable joint in the skull. All of the other joints in the skull are not mobile. They're suture joints or gomphoses like this. Alright, so the mandibular condyle, that would be the part that actually connects to the skull. That would be this part right here. So this is the mandibular condyle. There's one on each side. So I'm just going to try to show you all the way around. So this is the part that fits in and forms the movable part of the jaw. You can actually feel this on yourself. Just open your jaw and go, ah, and it kind of pops out. Ah. So that would be your mandibular condyle. Next, the coronoid process. That's the other part. That would be this part here. So this is what connects to your jaw. This is kind of like a crown. Maybe if you look at them together, it looks like a crown. I don't know. But anyway, so one on each side, coronoid process. Next, you have the mandibular notch. That's the spot in the middle. So here you have your mandibular condyle, you have your coronoid process, and here you have the mandibular notch. So all these are formed right here on this edge. There's this one on each side. Next, you have the ramus. So now we're going to branch down. So this here, this is the ramus right here, and on the other side, so the ramus. All right, and then the other part of the mandible, I'm going to skip down, is called the body, and that would be the part that forms like your lower jaw and your chin area here. So this is the body of the mandible. This is the ramus of the mandible, and this area here where the ramus and the body meet, that is the mandibular angle. So this right here where they meet. So I'm trying to see, it's not really shown well on any of these, but anyway, this is where the mandibular angle is, right on in here. So the angle. So I guess it's an obtuse angle, so you can feel it right here. So here's your, this down here. So in a male, males tend to have a more square jaw. That's one of the defining features that they'll look for if they're trying to identify someone only by their skeleton. So a square jaw would be more characteristic of a male. But females can have, just depending on the shape of the face, somewhat of a square or maybe a more oval rounded portion. So we already talked about the body. This is the body. Next, you have the mandibular foramen. All right, so this here, the mandibular foramen, this is what the dentist is going to numb when you have to have dental work. Hopefully you don't, but in the event that you do at some point. So it doesn't show up as a hole on this, but it would be this area right here. And you can kind of follow it a little bit. So there's the hole, and you can see how it just goes on down. There's a line right there. You can see it going all the way into the teeth. And then there's one on the other side as well. So there we are. So this here, this is the mandibular foramen. So remember, foramen, a little hole that's generally there for the passage of nerves. So that is all 7 features that you need to know on the mandible. Now, there's also, look, here's the gums and the teeth if you want to look at those joints. You don't have to know those, but it's kind of a neat little feature on this mandible model here. Okay, so that's the mandible. Now, let's also now move down. So let's talk about this spine. Now, there are technically 5 divisions of the spine, 4 that you're probably much more aware of. So, and we're just going to go from the top down. So the first part, you have your cervical spine. So cervical, here, this is going to be like your neck. And so you have cervical vertebrae, and there are 7 of them. That's what you need to know. There are cervical vertebrae, and there are 7 of them. I'm going to get into what a cervical vertebrae looks like. Next, you go on down, and you have the thoracic vertebrae, and there are 12 of those. And the way you remember that there's 12 is because you have 12 sets of ribs. So each one of your thoracic vertebrae connects to a rib. So 12 pairs of ribs. Then you have lumbar vertebrae. This is down in the low back, so low back, lumbar. All right, there are 5 of them, 5 lumbar vertebrae. You have the sacrum, and so the sacrum, there are technically 5 vertebrae in the sacrum, but they're all fused together, so it's just like one plate. And then at the very bottom of the sacrum, you have the coccyx, which there's around 3 to 5-ish. It kind of depends on some ethnicity as well, whether there's 3 or 5. And those are at the bottom of the sacrum, so they're also fused together. We call this your tailbone, and you know when you sit on it wrong, it hurts. So, or you know when somebody is sitting on you, and you're like, oh, your tailbone hurts. If you have a child, you're definitely familiar with this process. Okay, so when, I'm just going to demonstrate here. I don't have a full spinal column to demonstrate, but these are lumbar vertebrae. So this here is what it looks like from my front. So if you were looking at me anteriorly, this is what you would see as my spine. When you look at me to the back, this is what it looks like. You go, whoa, that's all rough and crazy looking. Yeah, that's why your back feels all like knotted, because it is. All right, so these are 3 lumbar vertebrae, and they're all stacked on top of each other. And so what you have here is you have your intervertebral foramen, and that would be this opening, and there's an opening between each set of vertebrae, and this, see if you can get, there you go, there's a hole, you can see it right here. Ooh, there's a finger. Okay, this is where the nerves come in and out. And so this is where like the spinal nerves pass through. There's also one that goes this way. Ooh, that's where the spinal cord goes. We'll talk about it in a minute. But the ones between the vertebrae, this is where each one of those 31 pairs of spinal nerves that I talked about that's on your lecture test are going to come out. So we're not going to talk about the specific curvatures of the spine. Just know the spine curves. And it's supposed to. Now, let's talk about a vertebrae. And when we talk about vertebrae, we are going to be on page 266. So, here, when you have a cervical vertebrae. So this is a cervical vertebrae, or vertebra. Vertebrae is plural. Vertebra. Okay, so again, this is the anterior view. This would be a superior view, inferior view, posterior view. All right, but when you're looking at this, most of the time you're going to be looking at it like this. So this is a superior view. So here's anterior, here's posterior. Now, some defining features of a cervical vertebrae are going to be these holes right here. So there's 2 holes. Your thoracic and lumbar vertebrae don't have these. And so they got this tiny little Y up here, and they got these holes, real big area, very thin up here. This is where the spinal cord goes through. Now, we'll talk about, this is a transverse foramen if you care about that, but we'll talk about that more in a little bit. But so your cervical vertebrae are going to be fairly small because they're at the top, they're in your neck, and if you kind of feel there's not really that many notches on your neck, so that would be this part that you're feeling here. So typical cervical vertebrae, small, real small area there. But these two holes and the tiny little peace sign, TV antenna at the top, are kind of what's going to define a cervical vertebrae. Now, next you have a thoracic vertebrae. And so here is your superior view, inferior view. So if you're looking at this, I'll try to make it so it looks the same as it is in the book. So this here, this is your body of your vertebrae. There's only one of these. So look on your cervical, you had little rabbit ears, TV antenna. So here there's only one. Notice you don't have those little holes there. This part is bigger. And so this looks different than the cervical vertebrae. So it's larger anyway, and then it has a few other defining features. We'll talk about some specifics of the thoracic vertebrae in a little bit, but let me also contrast that with the lumbar vertebrae. So the lumbar vertebrae are huge. Look, when I look at this, I think it kind of looks like a crown. So look, it's like a crown. Okay. But so it's going to have this huge body here. All of them are going to have this, and this has like multiple little wings. So there's actually 5 of them. So here you have rabbit ears, here you have one, and here you have the crown. So this is a lumbar vertebrae. Make sure you know the difference between what's a cervical, what's a thoracic, and what's a lumbar vertebrae. All right, so now on page 5 of the handout here, so I'll start with the thoracic vertebrae. The main part here, the body, that would be the part that stacks on top of each other. Okay, and this is the anterior portion. So it's going to stack, these are going to stack on top of each other. I don't have another one to stack on top. But next, you have pedicles. Be sure I tell you this. Pedicles. These are like some little feet. And those, if you turn this way, they're this little area under the body here. It's not very easy to see. So these little parts here, these are pedicles. Make sure I tell you that right. Yeah. So pedicles, little feet. All right. Next, you have the lamina. The lamina of the thoracic vertebrae is, make sure I tell you right. Got this oriented correctly. No. Okay. So is this portion. So if you're looking here, there's 2 of them, one on each side. So this portion here of the vertebrae, that's going to be the lamina right in there. Now, the transverse process, if you look at this, so think transverse goes across. That would be this. So transverse process. So technically these little tips. So there's one on each side. They go across. So transverse process. Right like that. Next, you have the spinous process. And that would be this part that you feel in your spine, in your upper here. So just kind of feel along like where your ribs are, or feel on somebody else. You feel this part. This is the bony projection. So this is your spinous process. Next, you have your superior articular process. That would be this part right here on the top there, superior articular process. Now you actually have some on the bottom too. That would be this little tiny portion that's kind of like a point that sticks out, one on each side of that transverse process. So inferior, so bottom, articular process. Now, next you have the vertebral foramen. That would be the large hole. This is where the spinal cord goes. So spinal cord goes all the way down. And then you have your intervertebral disc, which is not actually shown on here, but now I can show you on my stacked. These are my lumbar vertebrae. So you can kind of see that these don't stack exactly on top of each other because they're not supposed to. So there's really a little cushion, like a little pillow right in here, that's going to be that that cartilage that's going to help cushion this. So when bone grates on bone, that hurts. That's very bad. So you want to have a little bit of cushion here to help with compression, because you can see like the further down you go in the back, the more gravity is going to be pulling down and putting pressure on these. So that's why they kind of get bigger as they go down, because they have to withstand more weight. Okay, so, and let's kind of look at this from this sort of view here. So this is the spinous process, part of your spine. This is still the body. Now, here's your vertebral foramen, the large hole. This is where the spinal cord goes. And remember, as we're going through the T-spine, the spinal cord is still intact. It hasn't become the cauda equina yet. Okay, next you have your little feet. That would be this part that connects the body to the transverse and the spinous. So there's your little feet right there. And what else do I have? The transverse process up here, the lamina, this part, lamina. So kind of what's connecting there. All right, so that is your thoracic vertebra. Now things are going to be mostly the same on your lumbar vertebrae, but again, it's got this crown thing. Okay, so again, the body is the same. Still going to have your vertebral foramen where the spinal cord is going to go. We're not really going to call things anything different. I'm just going to kind of point out where they are on the lumbar vertebrae versus the thoracic vertebrae. Now, here you've got some stuff up top. So your superior articular process, these are a little bit more pronounced. So there's, one on each side. So it's this 2 points of the crown right there. These are going to be your superior processes. All right, and then you have an inferior process. These are really easy to see down here. So the superior, inferior, spinous process, got your wings, your transverse processes. Let's see here. And then your disc is going to be in there. So again, most of the things are the same, but this is a lumbar vertebra. And they all stack on top of each other. So I'm going to pause here, and then we're going to get into talking about some specific bones in the top of the spine.